Hi, welcome to our website, and we want to thank you for your interest in the hospital medical weight loss clinic. My name is Andrea Miller, and I'm a nurse practitioner here at Good Samaritan, and I am the nurse practitioner that runs the clinic here. And there is my name. There are two Andrea Millers, so don't be confused by that. So we want to talk a little bit about what we do here at the clinic and what are some of the types of issues that we see, and how are we going to get you to your goals of weight loss. So think about what brought you here. What are the things that you want to work on? Why do you want to lose weight? So it may be a medical issue such as your blood pressure or cholesterol, diabetes, different things such as that. Or maybe you just have some other concerns. Maybe you don't get out much because you don't like the way that you look, or maybe you're tired and don't have very much energy. Maybe you don't get to go on the trips with your kids or grandkids because you're too uncomfortable. So there are lots of reasons that people want to lose weight. And think about those things as we discuss what we do here at our clinic. And I'm sure if you have come to a clinic with an aggressive program like this, that you've probably already tried several things to help you lose weight in the past. So you've had some fad diets, maybe you are just watching portions, you started some exercise, and maybe those things did help some, but it didn't work very well and it didn't last very long. So one of the things that we focus on in our clinic is that obesity is a chronic disease. It is not a personality flaw. And we want to understand how it is that it works in our body and how it works in our brain. We want to treat it like a chronic disease, so very much like if you were going to go to your doctor and you were going to have your blood pressure checked. We want to make sure that we are keeping this in check, very much like that. So we do try to put together a comprehensive treatment, so not just a calorie count or not just a medication, but we want to treat the physical, the mental, and also any medical conditions that you currently have. And so one of the ways that we do this, it's called a very low calorie diet. And we're going to go into that just a little bit. So a very low calorie diet, here's a little bit more information here for you. It is medically supervised. It is approximately 800 to 1,000 calories a day. That is why it is medically supervised. It is pretty aggressive weight loss, with typical weight loss 3 to 5 pounds on average. Probably more for women, it's going to be more around 3 pounds, and for men could be up to the 5. And that's if you're following the program pretty closely. And also, this type of approach is effective for treating diabetes, high blood pressure, and high cholesterol, which are probably our 3 main chronic diseases in our community. Other things that we want to incorporate: lifestyle changes, recognizing that there are things that we're going to have to do to make this last for the long haul, and probably maintaining weight loss has been a very difficult thing for most people. But we want to improve your quality of life. We want to give you some energy. We want you to get back out and enjoy your life. And so, like I mentioned, the VLCD is a more aggressive type of program. It is a complete meal replacement program at around 800 to 1,000 calories. And we also do approaches with what we call a low-calorie plan that maybe combines some meal replacements with regular food. A little bit slower weight loss, but still a very good option for a lot of people. So the very low-calorie diet has 4 different phases. Phase 1 is when we come in and we go over your history, maybe your most recent blood work, see what is unique to you and what we got to make sure that we're watching and monitoring. Phase 2, this is the actual weight loss phase. So you can see that we do use some meal replacement type stuff. Also, we can combine in some grocery foods if you do not want to do the very low calorie program. So at first, and we will go over this a little bit later, but we do like to see you weekly, and it will be myself and a registered nurse. We have 2 different nurses that work here. One of them is Mary Beth Wagner, and she's a registered nurse, and also Patty Hoops is a registered nurse, plus all of our staff. A little bit different is the low calorie, just because obviously we have more, a little bit more leeway as far as how much, calories we allow you to have. It's still a low carbohydrate, high protein approach, but gives a little bit more flexibility for some people. Adapting, and that's when you get closer to reaching your goal weight. So we try to increase your calories and we try to reintroduce some types of foods that you maybe haven't had for a little bit. That phase can be however long, really. It can be up to 2, 3, 4 weeks, just depending. Maintaining. So this is typically when you get to your weight goal. It is one of the most important phases, but also one of the most difficult phases. And this is one that we really want to work towards during the whole program is how are we going to help keep this weight off? What are some things that can do? And you'll learn things throughout the program that will hopefully help you keep on track. So we do education every time you come in. Some of that's behavioral education, some of that's nutritional. We do talk about exercise, and that's every time you come in. So we want to make sure that we are preparing for that maintenance phase. There are at least 100 different educational handouts that we have available here and topics that discuss and things to make you think about and also to set personal goals. And some of the behavioral issues, we want to improve your relationship with food. We want to learn how to redirect stress and boredom and anger without using food as a comfort measure. We want to learn to establish if you are actually hungry or is it a response to something going on. We do individual sessions with you here in the office, and we'll figure out a plan. So some of the nutritional instructions, some of the topics that we typically go over, separating fact from fiction. So there's just a lot out there that maybe doesn't make a lot of sense to you. So we try to go through all of that. Learning how to make satisfying and healthy choices. How to eat out, that's a big one for a lot of people. We don't have a lot to do here in southern Indiana, southern Illinois, so we go out to eat for an entertainment. So how are we going to handle that if it's going to be part of our life? And those are things that we work on throughout the program. Exercise. Of course, exercise is very important for our overall health. We do have a lot of clients that maybe are not able to do an intense exercise program, so maybe they have arthritis in their knees or in their feet. We try to figure out some kind of exercise and give them opportunities to do some of those things that meets their physical needs too. So that is something that we work on. Exercise, surprisingly, it doesn't contribute to weight loss in and of itself. It does contribute to good mental health and good physical health. But its most important part is when we do maintaining weight loss. So let's talk a little bit about the cost of excess weight. So it is expensive to be overweight and obese. There is the cost of your physical health, of course. If you have, again, medical conditions that can be improved with weight management, medications that we can get you off of. A cost to your emotional health, definitely. We talked earlier about maybe being on the sidelines a little bit and not being able to really participate in life. Your financial health, again, just paying for medications, paying for insurance, different financial aspects. Relationships, it can be very straining on relationships with family and friends. So yes, the cost of excess weight in your health. And we talked about these just a little while earlier. But I don't think that I mentioned some types of cancer. The obesity is a risk factor for those types of cancer, and those are listed down at the bottom. So an obese person spent about 42% more on medical care. And this is an old figure. This is from 2013, so I would not be surprised if it's much more higher now than it is back then. But just to let you know that, again, it's costly. Obese men and women earn on average over $7,000 less than their non-obese counterparts. And I don't have the rationale for that particular figure, although I would highly suspect it's productivity related. In other words, when we are overweight or obese, we tend to get sicker more, we miss work more. That might be one thing that's contributing to that number. Other ways that weight impacts our life, listed there. So save with a very low-calorie diet, and we're going to work on those types of things. Your weekly food expenses may be less. We are going to go over here the cost. So it's difficult. If you choose to do the very low-calorie, and even the low-calorie to some extent, it's difficult because our world definitely revolves around food. If you are doing the very low calorie, you may be the only one at a particular event not eating. It's really hard if you're the one who prepares, food for your family in the evenings or anytime, actually. Entertaining is part of your business. I often give the example of we have a lot of drug reps that come in our office and bring lunches and different things like that. So it is challenging if you have those kinds of things. And then filling your extra time. So something to think about, if you have an hour for lunch and you have a shake and it takes 2 seconds to get that shake done, what are you going to do for the rest of your lunch hour? So you have some boredom or, some things like that. So people will notice. Definitely people will be paying attention, and you might be able to inspire other people to take a hold of their health. So these are some of the things that we do throughout our program. We definitely want to work on habits. We can replace old habits with new ones, even though that's a very difficult thing for a lot of people. So yeah, we want to take a team approach to weight loss and take it seriously, treat it like the disease that it is, and not just you are a weak person, and if you just did more and you just watched what you ate, you could really lose that weight, because we all know that there's a lot more that goes into weight loss than that. It is not calories in versus calories out. Our weight's affected by a lot of different things. Some of those are genetics, some of those are medications, some of those are hormones. So we're going to learn to understand about all of those things. So make yourself a priority. Make it an investment in your health. I think you will be very, very happy. Okay, so these are some of the costs of the program. So there may be some costs associated with your visits. The initial visit is more of a screening, as we talked about a little bit earlier. So we have some papers that we're going to put on the website that will do like the behavioral assessment and the nutritional assessment. But the office visit and then any labs, they may be part of the cost. I usually try to be very lenient with the labs, especially if you are not on very much medication. We may need to do some labs if it's been a while and your primary doctor has not done so, but we will see. So the weekly office visits, we like to kind of keep this schedule for the first month, especially with our very low-calorie patients. Weekly for the first month, every other week in months 2 through 6, and then once a month on months 7 through 12. So we do try to work with people. We understand that people have to work, and we are committed to helping you and meeting you on your level, although we do have to be safe about that. And as I mentioned earlier, just the labs may depend on what you already have in your chart, or what we need to get for you as a baseline. And I usually bill under a diagnosis that can be improved with weight management. So that is a very broad range for most people. And that might be some arthritis, or that might be just some joint pain, not necessarily arthritis, upset stomach, GERD, irritable bowel syndrome, hypertension, of course, and diabetes and cholesterol, which we've talked about earlier. But it's a very broad range that we typically bill under. Okay, so there are some averages. It's pretty highly specific once we get in and see what it is that you need to do. But if you're a woman, for example, that's on a VLCD, you're getting 3 meal replacements a day and 1 or 2 bars a day. The cost of the products is listed there for you. And same thing for the low-calorie diet. So they are pay-as-you-go. You can get them here at our office. They're not normally covered by insurance, so they are kind of pay-as-you-get them. And those prices are listed there as well. So as far as the products goes, those come in sets of 7. So one box will be 1 week's worth of products. We have some photos here for you to look at of the different ones. These are not a comprehensive by any means, but they are just an example of some of the different things that we have. We have a pretty good selection of products. I think you'll be able to find something that you like. So here is our address and phone number, and obviously you can get that on the website as well. We are located in Medical Center of Vincennes, right on First Street in Suite G. So let us know if you're ready. We're here. We're ready to help. We think that we can help you live a longer, healthier life. Thank you very much for your time.